The Kansas City Council late today votes to enhance efforts to fight fentanyl and other overdoses. City leaders say the response will approach the issue as a public health emergency, not unlike the pandemic. I'm John Holt.
I'm Lauren Halifax. They feel it's reaching those proportions. This would mean faster reporting, tracing cases. Fox 4's Jacob Kittelstadt's live at City Hall, where the council meeting just wrapped up. So, Jake, overdoses would now need to be reported within a day?
Yeah, that's right, Lauren. And in fact, the health department already requires this for other illnesses. Take, for example, COVID. Those cases need to be reported within a day. And for something more serious, like, God forbid, anthrax, those cases need to actually be reported within an hour. So this move actually adds overdoses to that same list. During a news conference, city leaders acknowledged the fentanyl crisis is not new, but it's persistent, if not growing, describing commonly found pills stamped M30 often having inconsistent amounts of fentanyl.
That's kind of the primary narcotic we're seeing. We're also seeing the powder form. We've had a couple cases in general where people have snapped one pill in half and one person overdosed from one half and the other half they did not. That just kind of shows the inconsistencies of those.
Everybody is referring to the opioid epidemic as an epidemic. And I'd like to say today we're taking some of those first steps to treat it as such.
That includes the hiring of 2 new overdose investigators to be added to the city's health department, as well as an overdose prevention education campaign and a mayor-appointed board to work towards solutions. The work is not separate from current enforcement, says Mayor Quinton Lucas.
This is not an issue that is as simple as saying, let's call KCPD, add 3 more detectives, and then we'll have the problem taken care of forever. In the same way, however, that it's not, we'll just call the health department and they will be able to prevent it by hiring 3 more investigators, 2 more psychiatrists, and call that a day. We are recognizing that when you have this substantial of a concern, it actually takes very real, consistent, and coordinated cooperation across agencies of Kansas City and beyond.
And this new ordinance will kick into effect on January 1st of next year. City leaders also want to stress that there's going to be a public education component of all this, saying that prevention is actually just as important as following up on these overdoses as well. Jacob Kittelstadt, Fox 4, working for you.